This is the Somalia teaching trip, day 1.
We're just about to take off to fly to Hargeisa in this cool plane. Check it out. It's the closest we'll ever get to a private jet. This is the male ward. This is kind of the other side of the male ward.
نظيف ما أدوك ملاحن هو قار ضدك هو حياة كل حنوصنة أيا ملاحن كل مركا من باي ما دش قاراه حال لكن ضدكي فربضانه قار بحاجة تبيه حاجة قطو حاجة سوق الربو مركا وحاصلنا وحاوقو عم
So I'm just here on the mental health ward. This is the male side. This is one of the dormitories for the patients. As you can see, it needs a lot of work. It needs a lot of cleaning. Yeah. This is the ward. Do you think there needs to be more cleaners?
Yeah, lot more clean.
You need a lot more cleaners.
حقا horta raashin baa meesha la keenay laakiin raashin baa lagu kariyaa raashinka lagu kariyaa iyo geerin waxaan kaas magarat ka raashinkan in la bedelo oo loo baahan loo mooyaane inay way joogaan waxa kale oo loo baahan yahay in loo keeno marka ay bil joogaan laba toddobaad markay joogaan loo keeno saabuun loo keeno ya dawladda xitaa ugu heersan soo diro xitaa shaqaalaha meesha
So this is the electricity section, and here we have a lesson going on, teaching them a course so they can work as electricians.
marka ay gacantu ka shaqeeyay wax gacanta inta boqosada furtaan gacanta ka shaqeeyay gacanta waa istaagay France abu shaqeeyay oo ay Turkiga wax ma baastay gacanta ka shaqeeyay
As one teaches, he is 25 years.
So this is the 3rd teaching trip.
Right.
Again, it's teaching the final year medical students, this time at Hargeisa University. There are 26 of them, so it's quite a big group. And the teaching is an intensive teaching course, trying to cover the basics of psychiatry.
Do you think it's been going well this time
I think it's been going really well. It seems to be going to time. We're getting through all the teaching.
Questions I asked, did you notice anything about the questions?
You were interested in the questions and follow.
Yes, so I wasn't really focusing on the issues.
As for doing this teaching,
this would be a really good opportunity for you to see how it works. Okay, so we shouldn't keep.
The head of the university, Dr. Deria, he came and picked us up himself. Now that is commitment, mate. I'd never see the Dean of Kings doing that, to be honest. What kind of symptoms did you have? What kind of diagnoses do they have? Do you know?
It's a different diagnosis.
Yeah.
In some patients, psychotic illness.
Psychotic illnesses.
Some patients have depression.
Depression.
PTSD with psychotic.
Oh, PTSD with psychotic symptoms.
Dementia also.
Dementia. You have some dementia.
Yes.
So some quite elderly patients with dementia.
Yeah. One patient said admitted in hospital dementia.
I see. Any manic patients with
Bipolar,
yes.
Bipolar disorder.
Yes.
Yeah.
I see.
And cat abuse also.
Oh,
Substance
cat abuse. Yeah.
Substance abuse.
And what kind of treatments do you use here?
Treatment is not available in the mental department.
There's not much treatment
Yeah,
available.
not much treatment, but now it's available in treatment. Haloperidol, Docanoate, 50 milligram.
Okay, so use the depot. Yeah.
Haloperidol tablet.
Oral haloperidol.
Chlorobenzene tablet.
Okay.
Amitriptyline.
Yeah.
In some of the drugs of small, for example, is a fluoxetine.
Fluoxetine.
25 milligram also.
You've got some risperidone. Oral or?
But it's small. Risperidone and fluoxetine. It's very small.
I see. Right.
Yeah.
I understand. And the risperidone, do you have oral or the?
Oral.
Oral.
Risperidone is a tablet.
The tablets, yeah. Okay, yeah. You don't have the injection risperidone.
No.
Okay, I understand. Right. And do you find that your patients get better?
Yeah.
Have they been improving?
Some patients improvement, some patients relapse.
Really, some patients are relapsing.
Relapse because when the admission to the hospital is improvement.
Yeah.
And the patient is to discharge.
Yes.
When to discharge is a beginning chewing cat.
Sorry, start chewing cat.
Start to say chewing cat.
Yes.
Chewing cat. Day and night is chewing.
Yeah.
But it's difficult to how to sleep. And sometimes the patients are jobless in the night.
So they're not jobless, they're jobless. They're chewing cat day and night. And
Day and night. And then it's
so they can't sleep, so they relapse.
relapse.
Yeah. And then they come back here.
You come back to the hospital and it's very difficult how to manage that patient.
I understand.
maxaad dareemaysay
waan xanuunsanayo marka ilaa xamar baan iska xanuunsanayo adigu berigii xamar wixii aan qabay waxay ahaayeen adigu quraan baan isaari jiro masaajidaan geli jiro jin iyo wax caynkaas anigoo bogsaday oo anigoo joogaan shaki iyo waxba ay galay oo marka xanuun weyn baan dareemayo xitaa mid
yes
baa gacan iga dhacday oo in baan diliyo intay oo
dhintay
shaki waxaan siri
wuu ku dilayaa
wuu ku sixiraan siri kan
Oh.
shaki baa igu dhacay xitaa waxaan isku dayay inaan isku dilaan xitaa isku dayo
yes
afkaan isku celiyo xarig baan qaatay oo kii ugu horreysay la xidhay ama kuwaan bixiyo marka caafimaadku mar buu isoo kordhayo marka xanuun badan baa markaa dareemay markaa xitaa waxaan isku dayay qaar fara badan baa la dagaalamayo.
How do you find the medication? Do you think it helps?
Urdadii baan helayo waan seexdayo marka
yes it helped me a lot now I sleep well I do feel well
That's very good.
waa wax fiican
Look at that monkey. You see that? A little kid with a monkey on his shoulder. That's incredible. The monkey was bigger than him. What about the use of chains? Were you ever put in chains when you were on the ward as a patient? Do you think that chains should be used or they shouldn't be used? Do you think they should stop using chains? I noticed on the male side, a lot of the patients are chained.
Yeah.
How do you feel about that?
It's very bad.
It's very bad.
But the patients is scared and not safe in the law and running.
They try and escape.
Escape.
They're absconding.
Yeah.
Staff.
Patients
Yes. The patients will attack staff. Okay, right.
In some staff is blind now.
It's blind. Oh God.
It's a chain. It's a.
He tied a chain around his neck.
And then it's a hang. And then it's a blind.
Are they still working or they left?
No,
he left.
They left, but he not see.
He can't see anything.
Anything.
Does it cause injuries to the patients? Or?
Some patients injured.
Yeah? With the chains.
With the
So
chain.
what do you think we can do to stop the chaining?
It's more staff is in the work.
You need more staff.
More staff and more training how to prevent the aggressive patient.
How to prevent aggression, yeah? How to calm them down.
Yeah.
And as you can see, they do use chains here.
Yeah.
It's better to be removed.
Yeah, okay. This is the seclusion room essentially. So it's for patients who are aggressive and are hard to manage elsewhere. And as you can see, it's pretty basic. And there are some chains just here as well. How do you feel about the use of chains?
adduunka qofku feelinka markuu helo iska joogay laakiin Soomaalida waxa ka xoog badan charge ay qaataan marka waxa weeyaan dad wax kasta siiso isma taagan ilaa uu dawlad ku dhaco marka inta dawlad ku dhacdo qasab weeyaan
unfortunately the only way they can manage it is by chaining the patients. It's tragic. It causes physical problems, they get bruises from the chaining, I imagine, and they can't walk properly and they get muscle wasting, but they just don't have the medication or the staff to use the kind of methods we use in the United Kingdom. Equally, in the UK, we're using nurses to restrain patients physically and then medication to inject them and restrain them chemically. And we still have patients who have died on psychiatric wards in Britain during control and restraints. So, again, we shouldn't be too quick to judge. But, there's a big problem here and it does need sorting out.
I mean, for you as an intern, being one of only a few junior doctors in the whole region, what's your workload like? Does it make it very demanding and difficult to cope, or?
Yes, it's not difficult, but it's a well-demanding job.
It's a demanding job.
You have to do jobs that are more than what you can afford sometimes.
Right.
Things that include covering many patients, many different wards.
Coping with a lot of patients, yeah.
Coping with the patients, with the scarcity of nurses.
Wow.
Yes. Sometimes you are forced to do some nursing jobs. Sometimes you do IV lines, you cut stress patients, you might take NG tubes, you might give medications to patients. Sometimes.
Yeah.
That demands also to come back to the hospital at the time that you don't have a job to do.
I see.
Yes,
you have to come and visit even when you're not supposed to be working.
Yes, more hours than we are expected to do.
You get 1 day off a week, right? Friday.
In the Fridays, the nurses don't do the jobs they are intended to do.
So do you come into the hospital on Friday? Oh, so you do come in on Fridays?
Yes, we do.
Wow.
Otherwise, the patients will not get their medication.
I see, right.
The point is an issue of responsibility. Are you actually responsible for the patients or not?
So, what does your job as a faith healer actually involve? When you treat people using the Quran, how do you go about that?
مروى القرآن تنوي عبان. إذا خد كان يسمي فتحة برانكا خد كان يسمينا وحنا كنا مختلف قرب دوين حرب الله من كيده مهمة أو نقول قياس نقف حمصني ولا يحسن.
Oh, so you use the ink made from herbal medicine as well, and that's the thing you understand. Okay. Okay, I understand. And do you think it works?
marka dadku jawaabta ay soo celiyeen ka soo waxaan u aragnay dadka way soo tilmaamaya oo xanuunada suuqa ay ka shaqeystaan ama xaafado soo tilmaamaya meeshii oo halkeen uga maxaysiis ka sameeyeen inaan dawooyinkiga aan ku shaacino xaysiisku wuxuu noqday soo tilmaamka dadka.
So what kind of patients do they refer to?
sidaan ugu hore shaqada ku bilownay waxaan waxay ahayd in aan cilaajino markii ugu horeysa wixii duro la isku dhacdo sida jinka sixirka isha waxa inkaas oo la yiraahdo xanuunada dadban in caadiga ahayn markii labaad waxay meeshii isku bedeshay markuu in noqoto meel qaabisha xanuunada guud oo dhan waxaana aan keenay dawooyin fara badan oo dawo ah xanuunada.
So tell me about the herbal medicine.
xawaasuuda oo kale sida intii noo sheegtay حديث النبي عليه الصلاة والسلام حباسوده عذر كستوى كده وجير ذموي.
You're saying they're trying to set up some kind of regulatory body for these faith healers. He said he's dead against beating patients, which some faith healers do. So obviously, I was really pleased to hear that. And yeah, he also said that sometimes doctors refer patients to him. He refers patients to doctors. So kind of working fairly closely together, and I think that kind of model of faith healing is probably quite a good thing, because they don't have the resources to treat everyone using psychiatric methods, so at least it's meeting some of the need, and then hopefully the more seriously ill people can get referred to services, because their faith healer is going to be their first port of call rather than the hospital. At the moment, I think regulation around faith healing, eliminating all those faith healers that go around beating people and strangling them and burning them, and then working with faith healers rather than just completely discounting them. Look at this. There's everything that you could ever want.
Yeah, you can get clothes, shoes, everything, and also some
How much? How much?
3.5.
3.5 each. Yeah? Okay, what about if we do $3, $4,
okay, yeah, I'll go after.
$8. 8 for 3? 1, 2, 3. 9.5? Now, what about 9? 9, yeah? 3.
هذاك which is it?
You go home. Come on.
هذا هي.
This is Khat. Yeah? That's what it looks like. I see. What does it smell like?
About $20. Yeah.
$20 for that whole
Yes,
bag?
for that all.
So this is a major problem here in Somaliland, because a lot of people chew Khat, and it does cause a lot of psychiatric problems, but there's some physical health problems. It's a really commonly used substance. How much do you sell?
About 5 pieces like this. Yeah.
Bundles, yeah?
5 bundles.
Do you think it causes any problems? So I just had a chat with a lady who sells Khat on the roadside. Very interesting conversation. She seems to be selling quite a lot of it on a daily basis. I think its use is pretty widespread here, and like I said, it does cause a lot of social and health problems around here. But then she also gave another side of the argument, which is that obviously she's trying to make a living, and she thinks that it stimulates people to work as well. I don't know how true that is, but yeah, it's fascinating. And it's, you know, there's one. She's selling Khat just here, and actually 2 minutes away there's another guy selling Khat. So you know, there are Khat dealers dotted all over the place. So yeah, I think it's quite a big problem. So Abdul Rahman, how long have you been chewing Khat?
14 years.
14 years, wow, okay. And what does it feel like when you chew it?
I feel relaxed and happy.
If you feel relaxed and happy?
Yeah.
Does it make you stay awake?
Sometimes.
Is that a problem? No. Have you ever had any bad consequences from chewing Khat? Have you ever, for example, got very scared when you've been chewing it?
Yes, you see more. Yes,
Khat makes him feel scared. And does he ever feel paranoid?
You say yes.
So that sounds quite bad. So why do you still chew it?
You say I'm still chewing because I don't have anything to do.
You don't have anything to do. Do you have a job?
I'm jobless.
If you had a job, would you still chew Khat?
You say no.
So maybe it's because you don't have anything else to do. Yeah?
I don't have anything.
How do you pay for the Khat?
You say I get some friends and some families.
So from friends and family. Do your family mind? Do your family mind? Do they like it? They don't like it, no? Okay. Okay. Do you think you want to stop?
Yes, he said if I get a job, I will stop.
So I'm just here with Abdi Razak, who's very kindly agreed to talk to me. He's been using Khat for quite some time. How long have you been using it, Abdi Razak?
For 25 years.
Really? Wow, it's a long time.
Yeah.
And how does it affect your life?
I feel some problem.
Really? Like
Yeah.
what?
Yeah.
What kind of problems have you been?
The kind of no sleep.
Really?
And not sexual.
Really? So it affects your sexual function?
Yeah. I feel sometimes for hallucination.
Right.
Yeah, my enemy.
Your enemy's talking about you.
Yeah.
It must be very upsetting for you.
Yeah.
Do you find that difficult?
Yeah, for her. Yeah.
How do you pay for the Khat?
Now, she's talked to my brother or my friend, and
Do you get some money from them?
Yeah, to give them some money.
I've got Abdullahi here with Isa. So Abdullahi, you've stopped chewing Khat, have you?
Yes.
When did you stop? When did you stop? And how do you feel now that you've stopped? What do you do? What's your job? And how did you stop? What advice would you give to other people who chew chat?
waxaan tala siinaya qofka hadduu nolol doonayo uu sharaf doonayo cisi doonayo inuu iska joojiyo daraagiska qaadka leena iyo wixii raac.
Do you miss it? Do you miss the feeling? He doesn't miss it, okay. Thanks, Abdullah, yeah? Assalamu alaikum.
Khat is obviously an addictive drug. It contains chemicals similar to amphetamines, and it's causing a lot of physical and mental health problems here, and it's a situation that needs to be addressed. Khat is such a big part of life here. You know, we saw the cat dealers or the cat couriers driving through the city, at really high speeds, and then they stopped and unloaded, and there's a part of the market which is dedicated to cat, and there were loads of people around haggling, trying to buy cat. So it's a big thing. But then equally, it's a socially accepted drug here, just like alcohol is socially accepted in the United Kingdom and other countries. And you know, we can't be judging them for using cat, no more than anyone should be judging the UK for the alcohol use there.
Miriam, how do you think the course went?
The course was great.
It was great. Wow, thank you. Do you think you might specialise in psychiatry?
I think I will.
Oh, you think you will? Oh, fantastic. That's a good result for us. Do you think that in the future things will get better here?
The future is waiting for King Culture.
So it's up to King's College?
Yeah, it's been a real eye-opener because, you know, apart from the teaching, which was a really satisfying thing to do, and particularly because the students were so enthusiastic, apart from that, I really got kind of insight into the culture here and what life is like. So it's been really special. I hope to come back one of these days.